Good evening, good evening, good evening, everyone. I am Jahari Stamps, a board member with Sharp, and today we have brought you all facts, the truth about the COVID-19 vaccine. So, just a brief history of Sharp. Sharp is actually an acronym for Southside Health Advocacy Research Partnership. It's a coalition created in 1995 that seeks to liberate economic, physical, and emotional through representation of the communities we serve, advocacy, resource coordination, and equitable partnerships. So today we join in the conversation of the COVID vaccine. What is the COVID vaccine? What does it do? Where did it come from? Why is it important? While also understanding that there is an extreme skepticism that comes when having these conversations with Black and Brown communities, which is why we were very intentional in choosing the people that we would have sit on the panel tonight to spearhead this conversation and answer some of you all's questions that you have sent to us. So first we have Dr. Doriane Miller, excuse me. She's the associate professor at Pritzker Medical School and the director of the Center for Community Health and Vitality with the University of Chicago. How are you? How are you, Dr. Miller?
I'm
Can you
well,
hear me?
Jahari. Thank you so much for having me this evening.
Thank you so much for joining
I
us
can hear
tonight.
you.
Okay, good. Just making sure. And we also have Dr. Maya Green. She's the medical director of Howard Brown Medical Clinics on the south side of Chicago. And she's also a room legend. So how you doing, Dr. Green?
I wouldn't say legend, but I'm good. I'm trying to get like you, but I'm good.
Uh,
Thank you so much for having me.
okay,
It's
look,
always great to see your face.
it's always great to see you also. So listen, ladies, before we jump into it, as I said before I introduced you all, it was very important for us to have the people answering these questions reflect people who come from the community that we come from. And we know that our country's history with vaccination as it pertains to our people isn't always the most positive light. So I'm really, really hoping that after we have this panel, that people walk away much more informed and we've given them as much information as possible so that they can make a sound decision in getting vaccinated. So without further ado, I want to jump right in. I'm going to actually ask the question to you, Dr. Green. What are vaccines and how does it work?
Sorry, the current
We can't hear
vaccines
you.
we have are the Moderna. Can you hear me now?
Yes, we
Yes.
can hear you.
The current vaccines we have are the Moderna and Pfizer. Right now, there are two out. Those two are both two doses needed. Once you go to get the vaccine, if that's your choice, you would just ask the person which one are you getting and which when do you need to come back because they have different days. So these vaccines work by something called messenger or mRNA. And a short description of that is if I'm building a building, like say I build I date myself by saying the Sears Tower, but the Willis Tower, everybody knows it because it has those two antennas on the top, right? And how this
Mhm.
vaccine works is it tells you build this building, build this cell, but watch these two spike proteins or the antennas on the top. And so the vaccine gets in your body. The body says these two antennas don't belong to me. So the body builds an immune response, a protection against it. And so when you get your first injection, it says, hey, these antennas don't belong to me. Builds protection against it. And then that second protection is just like, it's like, okay, first time, I saw you, I took your profile and everything like that. I'm going to take it back. I'm gonna tell my friends, I'm gonna tell my family. The second time when you get your second dose, it comes and it's like, oh no, nah, you are not from here. And it really sends the immune response to make sure your body is protected against the coronavirus as much as possible. So that's how it works. It builds immunity against the antennas of the Willis Tower or the spike proteins on the coronavirus.
Okay, okay. I mean, it can't really get any more simple. It's like being on a playground and you have that one person who don't belong there, and everybody kind of ganging up on that one person. to run them off the playground. So yeah, I appreciate that. So the next question is actually for Dr. Miller. There are many myths about vaccinations over the years, and clear some of them up. As I stated earlier, yeah, there's a lot of skepticism that comes with people being vaccinated. So if you can kind of unpack what are some of the common myths that people hear and that are floating around, and just kind of unpack that for us.
Sure. Thank you so much for the question, Jahari, and so glad to be on this panel with Dr. Green this evening. So some people believe that if they are vaccinated for COVID-19, that they're actually going to get the virus that causes COVID-19, and they're going to get a mini dose of the infection. But that's not true. People who receive it, as Dr. Green just described, they're going to react to this little spike that's on the outside of the virus so that the body recognizes it as of not being there, that it's foreign. The virus is a parasite. And the only way that that virus can reproduce is by attaching itself to the cells in your body. But if your body can recognize that it's foreign, it will block that so that you can't get the infection. And so that's something that's very important. There's no active virus in the vaccine. It is this messenger RNA or mRNA that's telling your body to make the protein so that your body says, not supposed to be here. You're not part of us. You need to get out of here. One of the other issues around myths around this is that this is something that I don't need to get because, particularly if I'm a healthy young person, it's not going to be any worse than the common cold. And even though most of the people who have had very serious infections from COVID-19 and unfortunately have passed away from it have been people who are older, that is, older than 60. A lot of people who are under the age of 60, especially people who have other health conditions like diabetes or high blood pressure, they may have cancer or their immune systems may not function properly. They have actually been at higher risk for having not just COVID, but also a complicated infection from it that may lead to being put in the hospital or even leads to them dying from COVID. So very, very important information.
Okay, Dr. Green, would you like to add anything to that?
Sure, thank you. And then what Dr. Miller said is super important. And I just want to pull out one thing that Dr. Miller said is this vaccine, you get it for yourself, but you really get it for your tribe, right? Vaccines, immunity works several different ways. One of the ways it works is the more people around me that are immune to it, the less likely the virus can attach to them and then pass to me. So if you think about why you would get this vaccine, yes, for you, but you also get it for your baby or your child who can't get the vaccine right now, or people that don't have access to the vaccine. That's why it's so important. Once we get the access to the vaccine, we think about it so we're prepared to make our decision on whether or not we're going to get it as soon as we get access. And we know where, get with your health care provider, find out where your access is. If you don't have a health care provider, they're federally qualified health centers that see people regardless of ability to pay and will give the vaccine. The city of Chicago will give the vaccine. It's very important because it's for your tribe. Coronavirus is, in my life, I've never seen something that so much hinges upon our ability to move as a unit. So you get the vaccine for yourself, but you get it for other people, the people you love.
That's an excellent point. I think definitely want to touch on is the
Think
fact
is
that when you
making a
say
really
it's not
important
just for
point here.
yourself, but for
And
your
if I
tribe people. We got a little bit. I'm sorry. Go ahead, Dr. Miller.
We've got a little bit of a delay. I think that you may be hitting on something with your comments, Jahari, that I was going to point to, and something that people have heard about on TV, something called herd immunity. And what does that mean? It means that in order for us to get rid of this pandemic, we've got to have a certain percentage of the population that get the vaccine so that everybody can be protected. So it's not just a question of doing it for yourself, it's a question of doing it for your loved ones, and it's a question of doing it for part of the society. We're estimating that it's going to take probably at least 80% of people, 4 out of 5 people, to get the vaccine in order to create that herd immunity. And the faster we can do that, the faster that we can get back to some sense of normalcy in our day-to-day lives. Because this has been going on for a year at this point, and we still got a ways to go.
We having a little delay. Well, yes, we definitely want to get back to our day-to-day lives. I know that that's very important, not only for myself. I'm tired of these masks. I'm ready to get back and be able to touch people and congregate around people. So Dr. Green had made a statement about protecting your tribe. And I know, at least for myself, doing work within the LGBT community, we work with populations that are of a compromised immune system. So it's not just me protecting myself, but me protecting the ones that I come in contact with. So Dr. Green, I kind of want to throw this question to you first, and then Dr. Miller, if you would like to respond after her. Is the vaccine safe, and how is it safe if it is?
So yeah, the vaccine is absolutely safe. So before a vaccine or a medication gets put kind of on the market, it goes through the Food and Drug Administration, or the FDA. And so the FDA sets these rigorous, standards where you have to study it and research. You have to do these things. You have to prove its tolerability. You have to make sure the human body can tolerate it. And usually a process can take years, but what I want to stress is how to make a vaccine. We've been having experiences with that part for a long time. And the reason why in other cases it takes years is because there's so many medicines on the market that the FDA sometimes gives attention here, attention there, and the process is kind of spread out. What happened with COVID is we saw so many people dying, and we saw loss of income, loss of life, not being able to see our loved ones, that the FDA recognized the importance of it. And so they said, hey, instead of 5 minutes here, 5 minutes there, we're going to concentrate right now to get a solution sooner, because in our communities, right, remember the coronavirus or COVID-19 is a disease that can kill in 10 days. Right. So they decided we're not going to piecemeal 5 minutes here, 5 minutes there. We're going to concentrate a lot of time to get this out sooner to save more lives. So a lot of times I hear it was just created so quickly. It was the attention was put on it because our loved ones were dying. And so is it safe? Yes, because it's gone through the research. It's past that. In addition to that, there were people, I'm African American, so I appreciate that there were African Americans in the research, when it was done. I also appreciate there are a lot of there were people of African American descent at the helm of creating some of these vaccines. So when I see that, we always talk about a seat at the table at the start, always benefits us in the long run. And so I appreciate that. So the answer, I know, Jahari, one of the things I love is Dr. Miller comes with her perspective. A lot of times we say the same thing from different perspectives, and that's what I think is beautiful. And I know but the bottom line is, yes, they absolutely are safe.
Ultimately, you want to it?
Thank you. I'm going to add just a little bit more to that for Dr. Green, and that is when the vaccine tested, people say, it's been a year. They started the clinical trials for this to test the safety and how effective the vaccines are a year ago, but actually for the kinds of vaccines that Dr. Green described, the messenger RNA, the science for it has been in the works for 30 years. And so that's something that's fly by night. We're very fortunate that we had the science background that when we were hit with this pandemic, we could use the science and the technology in order to accelerate the process of making this vaccine. Sometimes people think, well, most of these, what's called a clinical trial and testing whether or not a vaccine or a medicine works, takes place in people who don't look like us. For the Moderna vaccine, not only was it tested people of color Americans, 6% Asian, but the person who did the work on the vaccine from the National Institute of Allergy and Infectious Disease, the one that Dr. Fauci comes from, is Dr. Kazmikia Korp. And for those of you who are on, take a minute, Google her on Google, and you will see that she is a 35-year-old who was the one that developed this vaccine and brought it forward. And so it's not just a question of how it was developed, but all of the steps that took to take it there and the rigorous ethics behind how it was tested for safety and effectiveness. So again, very, very proud of our young sister who has done this. And it's something that's being done for Black and brown people and all people in the United States. But because we've been so seriously hit by this, it's something that for anybody who is listening and watching us this evening, you got to think about getting it.
Wonderful, wonderful point, ladies. And I'm glad that you all brought up the fact that there was a sister that was at the table in the inception of this vaccine, that we speak about having a seat at the table in these processes, and we actually had a seat front and center from start to finish in this particular process, while also understanding the concerns of our people, because we had the situation with the Tuskegee incident, where Black men were infected with syphilis, but in total transparency, it was a different time and we didn't sit at the table. So we always speak of these things about equity, and we actually had an opportunity to sit at the forefront of this. And I think it was very important to add credence to that, just as well as having you all on the panel today. So I thank you for that. And if you all have any questions, that means please post them in the comment section from there. One of the questions that preliminarily came to us was, why are there two vaccines? And what's the difference between the other? And this may or may not have come from me personally. Don't judge the question. I'm going to throw it to you, Dr. Miller.
Well, I'll give this one a try. Are by two different pharmaceutical companies, one called Pfizer, the other one called Moderna. The Pfizer vaccine has 95% effectiveness against COVID-19 infection. That's the one that they both require 2 shots. For Pfizer, you get 1 shot and then you get one 3 weeks later. For the Moderna, you get your first shot and then you get another one 4 weeks later. Infection and that we had as many opportunities as possible to develop vaccines that would serve as many people as possible. So as opposed to having just one manufacturer that has perhaps limits on the amount that they can produce over time, we have actually a number of vaccines. And fresh off the news this evening, I was watching before we got on to the show this evening, the Youth Authorization, the Food and Drug Administration. And so they think that one is going to be out as soon as it works, but still very effective.
Okay. So our 2 shots, and either one of you all can answer. I'll let Dr. Green answer this one. 2 shots mandatory in order for proper immunization. Have to have 2 shots.
Okay. Hi. Let me just check. Can you all hear me?
It's a slight delay, but we can hear you.
Okay. So absolutely, we need 2 shots in order for it to be fully effective. The only shot, as I believe Dr. Miller already mentioned, that the two that are out now require two shots. There's only one vaccine coming out, like next week. It got okay today by the FDA. Well, the FDA made a recommendation today. That's the one shot. So yes, the ones out need two shots. If your provider says two shots, go ahead and get those two shots, because the first shot gives you some efficacy or primes you, but you don't have that full capability or that full protection. Not only after the second shot, but actually 2 weeks after the second shot, your body really mounts up a response. So the ones Pfizer, Moderna, need two shots. There will be one coming out, and I always share this. And I think Dr. Miller did share it already. There is a one shot vaccine coming out by Johnson and Johnson. So if you're a person where you just don't want to see a lot of needles and you don't want to come back and get that second dose, get the Johnson and Johnson and ask, because they're not interchangeable. Pfizer, Moderna, two shots. Johnson and Johnson, one.
Okay, awesome. Thank you for that information, Dr. Green. So we recently came to the knowledge that CPS will be opening schools again. I personally am excited for that. I think that it really, really sucks that a lot of the children have been away at school, away from school, doing online learning. And I know that a part of being in school, we had to take measles and mumps vaccinations prior to being able to attend. What are your thoughts around making it mandatory or mandating for children to be tested to be immunized, excuse me, with the COVID-19 vaccine, and how will that affect successful reentry into school population? So I'll let Dr. Miller answer that question, and then Dr. Green, you can add to it.
Thank you. So the vaccine will not be mandatory for either teachers or students that are going to public schools. However, I think that when we talk about this issue of her, that is protecting ourselves and protecting people that are in our closest, our close connections, that people will probably be strongly encouraged to get it. I know that one of the discussions that's been taking place with Chicago public school teachers is making sure that they have access to the vaccine, because they are essential workers. They are in frontline providers, from my perspective, in terms of providing our children with an education. And so I'm hoping that this is something that people will opt to have, because they want to protect not just themselves, but they also want to protect their neighbors. However, this will not be something that is mandatory at this point. Whether or not other employers will demand that people get the COVID-19 vaccine as a condition of employment, that's yet to be seen. But at this point, it does not seem to be something that is going to be pushed by the federal government, certainly.
Thanks for answering that. So I get the vaccine. What are the side effects? How does it make me feel? What is the probability that I'll get sick? I'm going to ask Dr. Green to answer that question for
Far, what we've seen is one of the side effects is you feel a little irritation at the injection site. Some people get a headache, and fatigue, and some people you just feel a little down. Um, I want to point out, and when I hear this and when I experience it, I want to point out that your body, that's your body's mounting a response. So anytime something enters your body, one of the things your body will try to do is, oh, I want to defend myself. I'm gonna turn up the heat, and so you feel that fatigue, you feel that headache, you feel all of that. And also remember, they're depositing something in your arm. So anytime, just like anytime you get the other vaccines and stuff like that, anytime that happens, you're going to feel it, because they're depositing liquid into your arm, and then that liquid is then distributed to your body. So those are the main ones. Dr. Miller, I don't know if you want to kind of add on, but those are the main ones I do see. Now, I did hear, one of the things that's going around is that people are getting paralysis, something called Bell's palsy, and having seizures and things like that. When I hear that, I always say, always check the science. So something I find very helpful is I look at how many people get that in the population, just the everyday, no COVID, walking around, how many people are going to have that experience, right? And then I compare it to how many people are having the experience getting the vaccine. We've seen that the incidence or the amount of times people get it with the vaccine is actually lower than the general population, which means a lot of times that person was just part of who would have experienced it without the vaccine. So that's one thing I always say, always check the science kind of behind it. Dr. Miller, I don't know if you want to add anything to it. Uh-oh.
Well said in terms of the people who have received the vaccine and having gotten this partial paralysis of the face, which is temporary, that there's no difference between in the trials the people who got the vaccine versus people who did not. One of the things that they teach as doctors is that we don't share things about our personal lives or personal experiences with our patients. It's just that's part of the rules of being a doctor. And I have to say that in the case of COVID-19 vaccine, when my patients ask me if I've gotten the vaccine, I tell them yes, I have gotten both of the injections of the Pfizer vaccine. And I'm very honest with them about what I experienced both with the first so that they know how I experienced it and to know that they may experience some of the same things. They may experience mild and not have any side effects from it whatsoever. Because one of the things that I take on as a responsibility as an African American woman physician is that I'm one of these hopefully trusted messengers in our community that can provide scientific, fact-based information about the vaccine because I want to do whatever I can in order to help the people that I serve.
Awesome. So I got a question on my list, and there's a question from LB Marshall in the chat. So shout out to LB. Thanks for this question because it actually segues into my next question. So he asks, where can one get a listing for people to, if you wanted to, if you were interested, excuse me, in going to get vaccinated? And I'm going to segue that question into what if it was a person who's undocumented or without medical insurance or anything like that? Would they be eligible to get it, and where can they go to get it?
Mhm.
Dr.
Well,
Green, I'll allow you.
okay. Thank you. That's a great question, actually. One of the things, one of the tools that I tell, that I've used and that I give to my family, friends, or patients is there's a cdc.gov. And if you go there, cdc.gov, if you go there and you look for where it get tested, you can find that. And I always, one time I said it, I talked about city of Chicago, and people were like, yeah, I live in Texas. Yeah, I live in, California. So start cdc.gov, and then your local health department, wherever you live. Specifically for Chicago, the Chicago Department of Public Health, um, and the city of Chicago, if you go online and say, where can I get vaccinated in Chicago? They have a link, and that link will take you automatically to something called Shy Coach. And on that link, not only can you look for where you can get vaccinated, vaccination sites, but you can also find a link to talk about where if you have symptoms, if you think you have symptoms of COVID, you can log in and they can, you can compare that list. You can also give feedback if you got the shot, and you can also track how well we're doing in Chicago. Now, if someone is what they call undocumented, you can go to any federally qualified health center or FQHC. You can Google FQHC in Chicago. And usually we have the vaccines. We're required to see people regardless of ability to pay, regardless of documentation status. And you can get on the list to get the vaccine there. Now, with that being said, right now, Chicago is in stage 1B. and which means we're vaccinating people who are 65 and older, as well as essential healthcare workers. And essential workers. I said healthcare is on the healthcare hammer and nail. Sorry, essential workers, because we know there are essential workers out there that are not in healthcare, like our teachers, like our environmental specialists, like our postal workers, right? And so we you if you oh, one of the things I want to say, sorry, is look at the list at cityofchicago.gov, but do not look at that list and decide that you don't qualify. One of the things I see in our community that breaks my heart, we'll read a list and decide automatically, oh, I'm not on the list. You contact the healthcare entity or your Department of Public Health, and you lead with, I want the vaccine. Where can I get the vaccine? If you're getting the vaccine, if you want to get it, lead with that and then find out the facts. But please, 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 community, do not read that list and then decide you don't qualify. You know.
Thank you for that. I want to commend both of you ladies first and foremost because of the fact that Dr. Green, with you being the medical director for the South Side of Howard Brown, and Dr. Miller, your affiliation as an associate and at the forefront with the University of Chicago, for those institutions being in front of this thing since it kind of started, and you all's efforts to make sure that the knowledge and information is given out to the community, and also that last piece of where we can go to get vaccinated, assessing a list, and trying to make sure that people are, if they are interested, leading them to a path that they can get it. We actually had a comment by SD Ali, and he states that, or they say, excuse me, that I'm actually a healthcare worker and sitting on a waiting list for a vaccine here without any scheduled appointment. Any ideas? So Dr. Green did just kind of echo that essential workers were at the front of that list. So if you can just kind of double back around to that question, Dr. Green, and also when you say essential workers, break that down, because people like me, I ain't gonna speak for the rest of the world, but I know, like me, I hear essential workers and I automatically just will assume this healthcare workers, when I know in fact there is a plethora of jobs that fall under that category. So if you can kind of unpack that and also lead SDI lead to some resources.
Okay. Well, the FQHC that I work at is Howard Brown Health. Our main number is 773-388-1600, and you can call and ask to be directed to the COVID hotline. Our website is howardbrown.org. We have a COVID dashboard on there, and you can click the dashboard and it'll link you. You can it'll link to call by computer, or it'll send you the link to a specific number, and it'll ring to a specific number where someone's there to answer your call and your concerns about getting the COVID vaccine. Right. And you do not have to already be a patient at Howard Brown in order to get the vaccine, even though we are giving giving vaccine to our patients who are in the 1B category. But howardbrown.org, or reach us at 773-388-1600. Now, in reference to your question about the frontline essential workers, or frontline essential, that means people who are working in corrections, people who are first responders, people who are working in our grocery stores and in manufacturing and factory settings, people that are education workers, our teachers again. That includes daycare and K through 12 and early education workers, people who work in public transit, right? Other manufacturing and agricultural workers, so our farmers, right? And continuity of government and postal workers, so our postal service and caregiver. If you're giving care to a child or adult that needs like home assistance, you're the person taking care of them, you also qualify as a frontline worker. Now, Chicagoans, if you're 65 and better, right? We're welcoming you, and that's in the phase. And if you're working or living in a homeless shelter, correctional setting, or other residential settings with local outbreaks. So if you're living in what they call congregate living, like you live close to other people for what, and then you qualify. So phase 1B started on January 25th, right? And so step to the front, give us a call. Again, the city of Chicago does have a list, and the city of Chicago is also getting ready to do mass vaccination sites. So you can go to chicago.gov for that information. I don't know, Jahari, did I answer the question? I don't know if you can reach them. I hope I answered it.
You actually knocked it out the park. Thank you so much for that because I like to parade around like I'm this person, but I'm really blind at heart. So I appreciate that. Dr. Miller, is there any resources that are particular to the University of Chicago as it pertains to frontline and essential workers?
So we have a bit of a broadcast delay. So I heard, are there any resources? And then you dropped off.
Oh, I apologize. I was in because um SD Ali's question was well their comment was stated that they are an essential worker, and Dr. Green just said how Howard Brown had um prioritized essential and frontline workers. So I was asking, was that a resource also giving to individuals at the University of Chicago as well, or through University of Chicago Medicine? I'm sorry.
Thank you. So through University of Chicago Medicine, we're following the city public health guidelines in terms of availability of vaccines for our patients. And we're prioritizing people who are older and people who have health conditions them at risk for having more serious complications. Those patients put into a lottery, and that we call or contact them through something called the way in which patients can talk to their providers through the internet in a secure to come in to get vaccinated. So I've had a number of my clinic patients to come in that have received the vaccine. And I'll tell you something really interesting about receiving the vaccine and my patients who want it versus some that are who are over the age of 70 are saying, give me the vaccine, give it to me now. When can I get it? My patients that are between 45 and maybe 65 to 70, more of them are saying, I want to wait and see. But I have to tell you that one of the things that is really important about when your turn comes to take it as soon as possible is that the virus itself can change its structure and can possibly have something that's called a mutation, which may mean that the vaccinations may become less. However, if the vaccine cannot mutate, and that means changing its structure to try to avoid the vaccine, it cannot do that if it cannot reproduce. And so by getting the vaccine, you stop the virus from reproducing, and therefore you start to cut down on those possibilities of the virus mutating.
Thanks, sir. Um, so another question that we had come through via one of the Facebook inboxes was, what is the probability that things will go back to normal, where we're able to touch our friends and be in close proximity with people, not walking around with masks on? Dr. Miller, can you give us any insight on if that's even something that's possible, and what exactly would it take to achieve that level of normalcy that we once kind of had and took advantage?
Yeah. Um, this particular question makes me feel a little bit tender because I'm a hugger. People is something that I treasure in my personal life. And from time to time, um, sometimes if my patients ask me if they're going through a hard time of it and if they need a hug, as their doctor, I will give a hug. And it's something that I have been able to do for some time. And I can see Doriane shaking her head in the background. She knows what I'm talking about. Um, it's gonna be a while. We really do need to look at making sure that we can get as many people those positivity rates before we can start opening up to some of our normal activity things like going to the movies, all right, being in a movie theater, um, feeling as if you can go out. And I'm not just talking about wearing a mask or goggles or a face shield, but doing the kinds of things that we, before March of 2020, we really took for granted. And so the joint effort of all of us and whatever we can do in order to get vaccinated and to follow those public health guidelines will continue to knock down the rates of the virus and the viral infection. And you may be saying, well, is it all going to be dependent upon getting the vaccine? And the answer is no. We know from other countries that put into public health measures like South Korea, like New Zealand, like Australia, that they were able to knock down those rates, to really burn out those pockets where it were popping up in a way that they have been able to start to return to a state of being normal. Um, but it takes group effort, concentrated effort in order to do that. And unfortunately, we have not had the will amongst the American people across the board to do that at point. We've had, we have 50 states, we have different levels of civic leadership in this space. I must say, in the way that they have taken this on, because particularly when we look at some of our neighbor states and what's happened there, that their rates 19 infections and also hospitalizations much, much higher than what we've seen here in the state of Illinois. So again, get on the same page, follow these guidelines of masking up, washing up, backing up, shooting up, and not the kind of shoot up that we think of for people that are using drugs, but getting their shots, a jab in the arm. We will get to where we need to be, but it may take us up to another year in order to get there. Dr. Green, I don't know if you've got comments on that. I saw you shaking your head in the background.
Yes, Dr. Miller, because touch is so much part of who we are as humans, um, and it's so valuable that we underestimate it. But also, when you said that, I thought about there are two parts to every disease: the disease itself or the disease itself. So, in this case, the virus and what the virus is doing. But the second part that a lot of times in caring for communities or caring for people, if we miss the second part, we can forget what the virus is doing. And that second part is how we as humanity respond to the disease, right? And so I said before, never have I seen in my life something that tested our ability to move as a unit, because literally, when we beat COVID, we will beat it together. And like you talked about the other states, when we don't beat COVID, we don't beat it together. So when we win, we're going to win together. But anytime in the past where we've not done so well, we've done it together. Whatever we do, we've got to do together. One community can't heal without the other. COVID doesn't know the state boundaries. COVID doesn't really know our ethnicity. COVID doesn't know any of these man made barriers that we put on humanity. COVID knows it wants to survive, and we have to move against it and fight it together.
Great point. Great point. Both of you doctors. So I want you to comment about
Well
LB Marshall.
said.
he said that those who are dealing with multiple health issues like HIV and diabetes, um, is highly pushed for those communities, and does the vaccine have a negative interaction with those medications that are already taken? So I'm gonna let you answer this, Doctor. And he's basically saying in a nutshell, how does the virus interact with pre-existing medical conditions and are on suppressive therapy?
Dr. Miller, did he say you answer or sorry?
Is that for Dr. or Dr.?
Hello.
I, I'm not sure. I think I'll start and then maybe you can jump in. So we know from people who have been hospitalized with COVID and have had more serious infections that by either sometimes being on a breathing machine or a ventilator, or even people that are passing away from COVID, that those people had some sort of what's called a pre-existing medical condition that made them more likely to be sick. So, unfortunately, I have had a couple of patients that have passed away, both of whom had pre existing medical conditions. And they weren't people that were in 70s or 80s. One person was in their mid 30s, the other person was in their late 50s. So, it is. The question of making sure that people are able to get the vaccination, and being at higher risk for infection, very, very serious. And it's one of the reasons why when Dr. Green was stating before about being in that 1B category, for the state of Illinois, it's been extended to 1B plus as of this week, in that people between the ages of 16 and 64 who have an underlying health problem like diabetes, cancer, they've received a transplant, they may be HIV positive. Anybody who's in that younger age range can get the vaccine now. Now, there's a little bit of a warning there in terms of people who live in the Chicago area and the 9 counties, in that unfortunately at this point we don't have enough vaccine in order to give to people that are in that 1B plus category. In the state of Illinois, if you are in that category and are living outside of the 9 county Chicago area, you are eligible for the vaccine at this point. But unfortunately, until we start to get more and more doses of it, we are staying at the restrictions of the 1B category at this time.
Green, you want to add to that?
Yes, and with that, I think Dr. Miller mentioned diabetes, asthma, heart disease. Something interesting that we saw in the city of Chicago, that indicated not so good outcomes if you got COVID, was access to food. And something, and when you think of social determinants of health, which brings me to the point when you think about that, a lot of times people like to say that diabetes is the problem or HIV is the problem and or heart disease is the problem. But here is something, access to food, and it was literally on the things that cause poor outcomes uh, identifiers, was also part, lack of access to food. Sorry, lack of access to food was leading to poor outcomes. We always think why, because people have to go out and get food, and we were in a shelter in place. Lack of nutrition puts strains on your body that diseases do, and so we have to really think about social determinants of health and where we and how we do and how we move as a whole, and not kind of silo diseases. So I always look forward to days where those inequities and social determinants of health come down. Specifically, to the question about whether HIV medicines can interact with vaccinations, or diabetes medicines interact with vaccinations. The answer is no. There's no evidence that medication to prevent or treat HIV have negative interactions with vaccinations. Jahari, if you'd allow me, there was also a question that many people ask me is, who should not take the vaccine. So if my medicines won't interact, what are some of the reasons why I may think about not taking it? Well, on the CDC, Centers for Disease Control and Prevention, on the CDC website, cdc.gov, you can look at the ingredients for the Moderna and Pfizer. And if you have an allergy against any of those ingredients, they're literally listed out, you know. And if you go to the vaccination and a vaccination event or your healthcare provider to get the vaccine, you can ask them and they'll look at your allergy profile, they'll look at the ingredients, and then they'll let you know. So the people who should not get the vaccine are the people who have allergies against the ingredients of the vaccines and people who have had things like your mouth was swelling, you had problems breathing, if you had to get an epinephrine pen and go to the hospital, that's a severe reaction to something. And if it was against the components of the vaccine itself, you should not get it. Also, people who should not get the vaccine at this time, the vaccines that are currently out start at a certain age, right? So Pfizer starts at 16, Moderna starts at 18, right? So 16 and older for Pfizer, 18 and older for Moderna. Right now, if you're not of age yet, say you're 3, then you should not get that vaccine, right? And in the future, as they come out with vaccines, always check the age recommendations and things like that. So if you're out of the age range for the vaccine or you have had a severe allergic reaction to one of the components of the vaccine, those are the only 2 people that I'm aware of that should not get it. Dr. Miller, did I miss anything as far as people who should not get the vaccine?
You caught it all.
Oh, thank you.
So post it in the comment section. We have we have some information for those of you all who want to walk away from this and be able to tangibly look at the things that we are discussing. As Dr. Green and Dr. Miller have both stated, a lot of that information is accessible on cdc.gov. I'm a person that believes that knowledge is power. And I also want to take this time again to thank you, ladies, for what you all are doing on this panel this evening. I think that society as a whole leans into what I like to call willful ignorance, or this concept of blissful ignorance, where if I don't know or if I haven't heard, then I'm unaffected. So it's great that you all have taken time out of you all's schedule, being front at the forefront of the front line, to come here tonight and give the community this much needed information, and hopefully they're a bit more aware as to how the vaccine works, how it affects, and just how, if we ever want to get back to a sense of normalcy, that this is a necessary step that we need to take. And as you all can see flashing across the screen right now was the breakdown for the age brackets. So kudos to you all for making those points. And I'm looking at the chat. If you all have any more questions for these 2 prestigious doctors, please, by all means, post your questions in the comment section. Personally, I'm walking away from this much more informed than I was walking into it. I was a skeptic. Um, I come from a back that is not very trusting of government processes and procedures. So it was important to me to know that there was a Black woman that was at the table in that virus inception. It was important to me and important to the organization on the board that I sit on to have 2 Black prestigious women sitting at the head of this dais, giving this information out to the community. It was important for me to have people who shared the same commonalities, not only to myself, but to the people they're trying to reach, to talk about what it is and kind of answer these questions and help us navigate through these processes. So I would like to thank you all again for that. And please, by all means, ladies, really quickly, can you please let everybody know how they can reach you all, not personally but professionally. We don't need no trolls or nobody stalking you all. Dr. Miller, where can we find you on social media?
So my social media is done on LinkedIn for professionals, but I am there for people LinkedIn accounts. I can also be found through the Community Health Focus Hour through Facebook, sponsored by the Urban Health Initiative at the University of Chicago Medicine. My profile is also on the UChicago Medicine website, which is uchicagomedicine.org, for people who are interested in reaching.
And I'll go ahead. I can't hear you, but I'll go ahead and provide mine. I am Dr. Maya 100 on Instagram and on IG. The other person I follow is Dr. Kizzy, which I love. Dr. Miller, I got to tell you, I love our dynamic because I call her Dr. Kizzy. You're like Dr. Kizmikia Corbett. I love that. And I follow Dr. Kizzy at Kizzy PhD on IG. I follow her. She breaks down not only the vaccine Moderna that her team created, but she'll break down on her. You can see on IG, she breaks down the Johnson and Johnson. Today she did that on IG because she anticipated that the FDA would approve it. And so she broke it down so it's all ready for us. But she also breaks down Pfizer and lets you know that the vaccine that's right for you is that vaccine that's right for you. And if you have a choice, if you have a chance to get the vaccine, get the vaccine. Quickly, I know we only have 3 minutes left. Jahari, I want to thank you for having us both. Dr. Miller, I want to thank you for being a trailblazer for myself and so many other um, humans, period. We always sometimes say black women and black men, and yes, that, but also you're a trailblazer for humans and what it means to be a doctor who cares for community. So thank you, Dr. Miller.
Dr. Green and also Jahari and also to Sharp, thank you so much for having me, and generations of people who are coming up and following behind in order to get the work done. You were one of those people that is the next generation. So I'm very proud and honored to be with you on this panel today. And thank you so much, Jahari, for having us.
Thank you, ladies, both for participating on the panel tonight. And I want Sharp. I also just want to send a real quick shout out to my board of directors, Noel Green, who is the outreach director and coordinator for Chicago Center for HIV Elimination, Joel Jackson of U Chicago Medicine, and Lathaniel Green. With that being said, everybody, thank you for participating in the chat with us. Hopefully, we have given you all some very valuable information. Please follow Sharp on all social media platforms. And with that being said, you all have a great evening.